Hi, it's Dr. Janet Pope reporting from At Room Now. I'm also Janet Burdope on Twitter, so please follow me. I'd like to talk about what's cool and what's hot in vasculitis. So there's a lot of sessions at the ACR 2021 that could be quite interesting in vasculitis. So I'll just highlight a few this time around. So abstract 505 is looking at VTEs from a large VA population throughout the US. And they're looking at VTEs comparing to osteoarthritis patients, age and sex matched, and looking in three groups: giant cell arteritis or GCA, GCA plus PMR, or PMR alone. And it was kind of interesting to me. Of course, you would think that clots are higher, arterial and venous, and active inflammatory disease such as GCA or PMR compared to OA, and that indeed was found. What's interesting and unusual is that it was kind of a dose response and not the way I would have thought about it. GCA had the most clots, arterial, venous, and of course, retinal occlusions. Then it was PMR with GCA, and then it was PMR, and all of them being higher than OA. And I don't know why that is, but I wonder if someone with PMR plus GCA maybe has less full burden of vascular disease. Don't know. We'll have to wait and see how the story unravels. The next thing that's kind of hot is subclinical large vessel vasculitis in PMR, and that might also be why there's more clots. And that was illustrated nicely in abstract 466. And a symptom or a sign of ANCA-associated vasculitis that's really under-recognized is well described in this abstract. So abstract 430 looked at the incidence or prevalence of interstitial lung disease in ANCA vasculitis. So we tend to think of large cavitating lesions, but in this abstract, they're looking at a retrospective chart audit and a large number of patients, and they found that ILD is actually quite frequent. It's almost as high as 1 in 3. So I think that's something I have to keep in mind when I'm seeing my patients. Then there was another study looking at treatment. So this is looking at abstract 507 and looking at an RCT and PMR of tocilizumab versus placebo. And what you could do was get really aggressive steroid sparing in a positive way to help our patients not run into side effects if you use tocilizumab. Far more steroid sparing in PMR on tocilizumab than placebo. What else is hot? Well, hot in PET scans. So Takayasu remains positive as a vasculitis for many years. It can relapse and remit clinically, but the PET scan done serially in many patients with Takayasu showed that it was still a hot scan over time. And that's abstract 504. So I think we have some clinical pearls of what we can take home when we start to see our patients with GCA, PMR, and ANCA-associated vasculitis or other large vessel vasculitis when we go back to the clinics after ACR 21. So please follow us at Room Now. Thank you.